Chita Tande. Today's Wednesday, March 28, 2024. My name is Peggy Moore-Louis, Community Health Educator for the town of Randolph. And the purpose again of Chita Tande is to provide information, health education to the Randolph community, particularly the Haitian community. And today is our second show, and I'll be interviewing one of the key public figures here in Randolph. His name is Gerard Cody, and who's the Public Health Commissioner for the town of Randolph, and whom I have the pleasure of working with as well. He's my director. And thank you, Jerry, for coming in. And Gerard, just to say a little bit about Gerard, has a vast experience and professional knowledge in the field of public health. And as a public health commissioner, Gerard has connections with many Randolph community partners who and has supported many efforts in the community, particularly this show. And I appreciate you allowing us to provide information to the Haitian community. Thank you and welcome.
Thank you, Peggy. I'm happy to be here today, and please call me Jerry.
Jerry?
Yeah, it's my name is Gerard Cody, but once you get to know me, you can call me Jerry. It's, we're really happy to be here today to represent the Randolph Public Health Department.
All right, so let's get into the questions here that I have for you. And the first one is about yourself, and I know you are much better, in a much better position to tell us about yourself and how did you get involved in Public Health Commissioner?
Well, Peggy, I've been in this field for 34 years. So I work for the town of Randolph as a Public Health Commissioner right now. But I'll go back to how I got to this position. And so I grew up in the city of Boston, and about the time when I was in school, there was a lot of talk about cleaning up this Boston Harbor. There was talk about what's called now the Big Dig. That was the huge construction project that took the major highways and put it underground in the city of Boston. And just as a person growing up in that area, just to see all of that construction and the moving of the earth and the projects related to that, I became interested in environmental issues. What I read in the newspaper was that there was a lot of contaminated soils when they were constructing this tunnel, and when they were constructing the Massachusetts Water Resource Authority Deer Island wastewater treatment plant, there were also a lot of concerns about sewerage and environmental damage to the waterways in the Boston Harbor area. So from that, I decided it would be a good idea to study biology, to learn more about how our bodies would interact with environmental hazards. And I also studied public policy. That was a way to tie in what I was reading about in the local newspapers about how these projects were developed, how they were approved, how they were designed, how they were discussed with the people that could potentially be impacted. So as a young man, I was able to attend a lot of these public hearings while I was a student, and they had them all over the city. And I've just found it so interesting to go to these public meetings and just to see how the public officials were able to interact with the residents. And I thought to myself, this would be a great way to have a career.
That's great. That's a lot here. So what did you had any other experiences besides this that led you to be the Public Health Commissioner?
Oh, sure. One of my favorite jobs while I was in college, I was able to work for the Massachusetts Fisheries and Wildlife, and my job there was to be called the environmental reviewer for the Massachusetts Endangered Species Program. And so it was a way to look at construction sites and to review plans to see how these plans could impact animals and plants that were potentially endangered in Massachusetts. It was very satisfying to work in that type of field to see if you could make a difference. So after I graduated from school, I was able to work for a laboratory where they took in samples of hazardous waste from a wide variety of locations, from landfills, from other construction sites, and I was able to work as a data reviewer to analyze the different chemicals that were found in the soils and the water. And I spent over 18 months in that type of position. And then I learned more about how these samples were disposed of. I was able to then move on to a large company that disposed of hazardous waste. And I spent 10 to 15 years in that industry for hazardous waste disposal. And we would travel to various clients all over New England, whether it was a hospital or a university lab or a research lab or a military base that had hazardous materials that needed to be disposed of. I was able to work as what's called a lab pack chemist, and I was able to help collect the samples, analyze the samples, categorize the samples of soils and waste and other materials to see how they could be properly managed, transported, and finally disposed of. Now, one of my favorite parts of the job was working with the different municipalities. There I was able to help plan and conduct household hazardous waste collection events. That's where residents would be able to take in paint-related material, automotive fluids, pool chemicals, pesticides, cleaners, or just things around the house that they don't need or want anymore, like old light bulbs, old batteries. So it's a way to keep these items from going into a landfill or being sent off for disposal in municipal trash. So by having that interaction with the different cities and towns all over New England, I was able to learn more about local public health and how maybe someday I could be in that position to help conduct one of these events for a city and town rather than just being the person that was working at the event. So after I graduated from school, I was able to work for a laboratory where they took in samples of hazardous waste from a wide variety of locations, from landfills, from other construction sites, and I was able to work as a data reviewer to analyze the different chemicals that were found in the soils and the water. And I spent over 18 months in that type of position. And then I learned more about how these samples were disposed of. I was able to then move on to a large company that disposed of hazardous waste. And I spent 10 to 15 years in that industry for hazardous waste disposal. And we would travel to various clients all over New England, whether it was a hospital or a university lab or a research lab or a military base that had hazardous materials that needed to be disposed of. I was able to work as what's called a lab pack chemist, and I was able to help collect the samples, analyze the samples, categorize the samples of soils and waste and other materials to see how they could be properly managed, transported, and finally disposed of. Now, one of my favorite parts of the job was working with the different municipalities. There I was able to help plan and conduct household hazardous waste collection events. That's where residents would be able to take in paint-related material, automotive fluids, pool chemicals, pesticides, cleaners, or just things around the house that they don't need or want anymore, like old light bulbs, old batteries. So it's a way to keep these items from going into a landfill or being sent off for disposal in municipal trash. So by having that interaction with the different cities and towns all over New England, I was able to learn more about local public health and how maybe someday I could be in that position to help conduct one of these events for a city and town rather than just being the person that was working at the event.
Yeah, and now that's what we're doing.
Yeah. And if I could put a plug in on Saturday, August 10th, 2024, from 9 a.m. until 12 noon, you can bring all of your paint-related material, pesticides, pool chemicals, cleaners, automotive fluids, computer monitors, tires, things like that you no longer want to have around the house. And we'll take those at 70 Memorial Parkway, right in the high school parking lot from 9 to 12 noon.
Correct. And this is one of our most popular events, and we're all here to take your stuff, so which is one very important, as Jerry mentioned.
In fact, last year we had over 400 participants come by.
It keeps increasing
Keeps
every
increasing.
year.
That's right. That's right. That's why I'm advertising it now.
Correct. So thank you, Jerry. So as you mentioned about the environmental health, I know this is one sector of the public health responsibilities. I don't know if you want to briefly overview and go with the other.
By training and my credential, I'm a registered environmental health specialist. I'm a registered sanitarian. So these are exams that I needed to take and pass in order to obtain these credentials so that I could perform this type of work. And in local public health, we have required duties in Massachusetts. And after looking at the required duties, I broke them down into 3 different categories just so that we could more easily distinguish the type of work and who was going to do that type of work. So the 3 categories are environmental health, community health, and emergency preparedness. And I can go into a little bit more detail about environmental health. So we talked about the environment earlier, but this is more of how a municipality would function. So if you were to go around a neighborhood of a typical municipality, you would see different stores. And one of the stores that we regulate would be anywhere that has food. So we're concerned about food for the public, how it's going to be stored, how it's going to be prepared, how is it going to be served. We want the food to be safe. We want the food in the restaurants, the supermarkets, the retail food stores, all to be safe for the public to consume. Because as you know, there's always a chance that somebody could get sick if the food is mishandled, if it's not in the proper temperature, or if it's stored improperly, or if it's exposed to other contaminants. Another program that we work hard on in Randolph is our housing inspection program. So what that means is that we have rental properties where people are able to occupy different dwelling places. It could be a 2-bedroom apartment, it could be a 1-bedroom apartment, it could be a 3-bedroom apartment. They're all, if they're rental units, and the person or the family living in that rental property does not have things that they need to live safely, like if they don't have hot water, if they don't have heat, if they have a window that's broken, or a lock on a door that's not working properly, or they're having trouble with the trash disposal, or they might have insects, or they might have mice or other pests, you're able to contact the local health department, and we have staff that will speak to you, and we'll be able to come out, make an appointment. We can evaluate the situation, maybe identify what some of the problems or barriers are, and then we have the ability to contact whoever owns the property and talk to them about what you're concerned about. And by law, we can send them an order to correct. It's a written action. And if they do not comply within a certain number of days, we have the ability to bring them to either the Brockton Housing Court or to the Quincy District Court. And this is all at no cost to the person that lives or occupies that rental property. So it's a program we spend a lot of time on, and we're very proud of it, and we get some decent results.
So there's no, to my understanding, there's no fees for the tenant or the landlord?
There's no
And
fees
the
from,
landlord.
correct, there's no
Okay.
fee from the health department. We wouldn't charge for our time to go visit the occupant or the person that's renting the apartment. We're obligated to help them by law, and it's called the state sanitary code.
Okay, that's good to know. I didn't even know that.
One more thing I could say about
Yes, go
that.
ahead,
So if there's
please.
a child under the age of 6, and the home was built, or the dwelling or the apartment was built before 1978, we're able to conduct a lead paint test. Some of us in the office are certified lead inspectors. We would be able to come out, test the paint in the house, and tell you if there's lead paint. And we care about lead because lead dust may cause small children to have developmental or neurological problems, and that's really something we want to avoid. It's rare that we come across homes these days that may have the lead paint, but it's worth checking out.
Good, good. So you mentioned violation for the housing. What about restaurant? Do they also, I'm assuming, have violations as well, if they don't?
Well, we hope they don't have violations, but if they do, we inspect the restaurants and we let them know what we observed that's wrong that could potentially lead to a foodborne illness. And we have the ability to either issue them a ticket or, more importantly, require them to get additional training. And training in food safety is really important. You want to be able to know that there's a person in charge of the store or the restaurant that has knowledge about how to keep the food safe. That's one of the things that we look for. And if we find that they're not compliant, we could remove their food permit, not issue them a permit. We could bring them before the Board of Health, which is a group of citizens that live in Randolph, and they are not paid, but they volunteer to help listen to different problems that we have in town and help us make decisions about appropriate next steps.
And we have we ever shut down a restaurant, for instance, if
You know,
they're
the-
in violation?
We have, and it's something that happens not only in Randolph, but in other cities and towns. We want everyone to be successful, but if we don't do our job, nobody else will.
Yeah.
It's a
and we
tough
don't
part
wanna
of the
be
job.
sick. Yeah. All right, so, so that was, the environmental is one of the categories, and
Yes.
do you wanna
So,
mention the other categories
the-
of
the
public
next-
health?
Category, I think of it as a three-legged stool with environmental health, community health, and then emergency preparedness. So, community health, it's a program developed to protect the residents from communicable disease. So, the local health department is required by law to track over 80 diseases that may spread from person to person. Our public health nurse, Ann Martin, spends much of her time monitoring these diseases on a computer program called MAVEN. It's the Massachusetts Virtual Epidemiology Network. She also visits people that may be actively sick, for example, with TB, tuberculosis. And the purpose of her home visit is to help make sure that people understand how important it is for them to take their medicine to avoid becoming more sick or contagious with tuberculosis. And this method is called direct observed therapy, or DOT. So it's a very important part of the public health nurse's job. So even if there's a dog bite, there may be a chance of spreading the rabies virus. Rabies is another disease that we would track. So our public health nurse would work alongside our animal control officer to help prevent any spread of disease from animal to animal or from animal to people. So that whole process is called zoonosis. And it's an interesting part of the job. We get calls in the evening, late evening, on the weekends, because the community doesn't stop. It just keeps going, right?
As you said, public health never sleeps.
Public health
That's-
never sleeps. That's a saying we have in the office.
Yes.
So one more thing about our community health program is our vaccination campaigns. So we vaccinate for influenza, we vaccinate for COVID-19, and that also falls under this category of community health. In a typical year, we vaccinate about 900 people for influenza. However, during the pandemic, we vaccinated over 55,000 people just in Randolph.
Yeah, that was unbelievable to be still because we were busy.
Well, Peggy, you had a major role in the COVID-19 too, at the very early stages. Peggy was our primary contact tracer. You had
And I was
organized.
just hired.
You were just hired. We had a small staff, and before we were able to ramp up. So really kudos to you and all the work that you did,
Yes,
Peggy.
so it's a teamwork, thank
Yes.
you. And let's cover about our last, before we take a break, let's cover the last.
Yeah, the last leg of the three-legged stool is emergency preparedness. So I think of it as a combination of both environmental health and community health and how we would respond to an emerging disease threat. So we always have to be ready to respond. We saw that in COVID-19, that was a disease that evolved rather quickly, and we had to come up with protective measures for the community. So by studying emergency preparedness, by meeting regularly with our other partners in town, like with our fire chief, our police chief, our town manager, our Department of Public Works superintendent, with our community programs director, we want to be prepared. We don't want to meet people for the first time as we have an emerging threat coming into our community. We want to be able to know each other, know what resources we could bring to the table to come up with effective strategies. So just like we have our internal planning with our own town, we plan as public health officials with over 30 other municipalities, ranging from Randolph all the way down to the Mattapoisett area. So if you were to draw a line from Randolph, go down Route 24 until you hit the Mattapoisett Fall River area, we would plan with all of those other cities and towns. We meet monthly, and it's called Region 5C. And that's where we're able to share strategies, conduct training, share resources, and also work with the Medical Reserve Corps. And as you know, Peggy, the Medical Reserve Corps is made up of volunteers that live in a community that have a vested interest in seeing that the community is safe and healthy. So finally, we serve all the people in the town of Randolph, particularly the underserved, and to promote healthy people, healthy families, healthy communities, and healthy environments through health promotion, education, and prevention.
Thank you, Jerry, for all these important information. And right now we're going to take a break. And this is Chita Tande, and we'll be right back.
Hi, my name is Brenda Lormel Raymond, oncology nurse practitioner, founder and lead consultant for VDI, a healthcare consulting company. In the United States, breast cancer remains a major concern, impacting countless lives. Breast cancer is the second leading cause of death among women, claiming thousands of lives each year. Black women are particularly affected. Today, we want to emphasize the importance of mammogram exams. Breast cancer affects millions of women nationwide, but early detection can save lives. A mammogram is a simple, non invasive procedure that can detect abnormalities in the breasts before they can be felt. By scheduling regular mammograms, you're taking charge of your health and increasing the chances of early detection, which leads to better healthcare outcomes. We urge all women, especially those over the age of 40 years old, to prioritize getting their mammograms. It's a small investment of time that can have great impact on your health. Let's unite as a community to support and uplift all women in this battle.
Welcome back to Chita Tande. Again, I'm here with Public Health Commissioner Gerard Cody for the town of Randolph. And right now, we know that COVID-19 is still around. And what measures is the town taking to mitigate and implement to ensure the safety and the well-being of the residents?
Well, certainly, we know that we no longer have our COVID test site, but residents can still get a COVID test kit from the town of Randolph. We have them available in the town hall. We're open Monday through Friday from 8:30 a.m. until 4:30 p.m. And you can take a test kit, you can take a face covering, or you can ask any question you want of a public health nurse. Now, we still offer the COVID vaccine and the flu vaccine every Thursday at the Randolph Town Hall from 2 p.m. until 7 p.m. You can walk in, you can register in advance, you will get vaccinated. It's free and it's available for all ages.
Thank you. And how does the Randolph Health Department collaborate with other local governments and community organizations to address public health challenges in Randolph?
Earlier I mentioned under emergency preparedness how we collaborate with 30 cities and towns, but we have a smaller focus group that is fairly new, and it's through what's called the Public Health Excellence Grant. And we are working closely with the Massachusetts Department of Public Health, and we are provided funding to hire additional public health staff. We call them public health officers, public health epidemiologists, and public health nurses. And right now, we're in a group that's called the Norfolk County 5 East. And the other cities and towns that we work closely with are Braintree, Quincy, Holbrook, Weymouth, and Randolph. And what we do is we meet monthly. We talk about how we can share services and how we can help with the food inspections, swimming pool inspections, nuisance complaints. A nuisance is anything that could possibly bother you. It could be a noise, could be an odor, could be dust, could be wild animals. We would be able to investigate and see what it is that's causing whatever that disturbance is. And there are other needs that a local public health department may have that's emerging that we don't know about. But that's why we want to all meet together and see how we can solve some of these concerns that a citizen may have.
Good to know. So what are the pressing issues right now in public health in our community?
Yeah, we're always looking to keep the community safe. And through the program I mentioned earlier called MAVEN, the Massachusetts Virtual Epidemiology Network, that our public health nurse Ann Martin monitors, we're able to see that asthma is a concern, diabetes, heart disease. Those would be considered the 3 chronic diseases that we would track and try to help people avoid. Another emerging communicable disease is TB, tuberculosis. We're also concerned about mental health. You know, we see cases when we go into the homes that we're invited into, we may come across a hoarding situation. You know, that might be dangerous because there'd be too many items in a hallway and people couldn't leave the building in case there was a fire or emergency responders needed to come in and help somebody. If there were obstructions in the hallways or the doorways, that might slow down their response. So that's why we're concerned about that. It also might lead to insects or other pests that could be hiding in the things that are accumulated in the hallways. We're also concerned about opioids and addiction and substance abuse. We're concerned about tobacco use with our youth. We want to try to prevent young kids from getting addicted to a wide variety of things. We also want proper access to health care, you know, addressing disparities among different community members. So just back to the asthma, Massachusetts has an elevated rate of asthma compared to the national prevalence rate. The causes of asthma are unknown. Sometimes it's related to traffic or vehicle exhaust, or it could be related to mold in a home, could be related to chronic dampness, meaning that things that are wet all the time, or it could even be mice or like the dander, the fur that comes off of mice sometimes triggers an asthmatic attack. They could, in there, those are the environmental pollutants like air pollution, and we talked about that, and also the dust. For those with asthma, it may mean that you have a weaker immune system. In a recent study, researchers concluded that people with asthma tend to have a suppressed immune system and may be less able to fight off the flu or other respiratory illnesses. So just asthma alone can trigger other health problems.
Yeah. Now, can you tell us the top 3 disease that you see in the community and the major, you know, the cause of deaths in Randolph?
Yeah, that's a good question, Peggy. So since we reviewed the data, we went back 5 years, and we found that the top 3 diseases since 2019 would be COVID-19. That was the largest number. I think there were over 12,000 confirmed cases during the pandemic. And then we had tuberculosis, and we had about 1,200 cases over the past 5 years. And then TB and influenza followed up with that, with cases coming in around 600 between both diseases.
And the cause of deaths are?
Yeah, so
in Randolph?
since 2021, heart-related with 276 reported cases, cancer-related 114, and respiratory-related 94.
And these were as of 2021, and now you're still monitoring, and how quick do you expect us to get new numbers?
So what happens, we work closely with our other town department, the town clerk's office, who help by collecting the different death certificates, and we're able to review the data as it comes in, and we build it month by month, so we are able to track our issues in town related to deaths and what causes death. And the whole idea is so that we can be perched and ready to respond and see if we see a spike in a certain category.
And the community is more than welcome to call as well. They'll give that information to them, right? It's public information.
Well, we publish our annual report, and that's how we usually share
Share
that
that
information.
information.
Yes, it's all public information. We don't give out particular names, but we give out disease information. We don't list it as a person or an address or anything like that. It's strictly the scientific evaluation of the data that we obtain.
Okay.
So continuing with our discussion about diseases in Randolph, well, right now we have 3 active TB cases. And so we have our public health nurse, Ann Martin. She actively visits the residents that have this disease. We want to make sure that they get better. We want to make sure that they're eating healthy. We want to make sure that they're getting enough sleep. And we want to make sure that they have enough medicine in order to contain this disease. It's a potentially serious bacterial infection. It mainly affects the lungs. It spreads from one person to another via droplets. So if you were to sneeze or cough, these would be the droplets that we're talking about. They're released into the air through coughing and sneezing, and when active presents itself with symptoms such as a cough, weight loss, fatigue, and fever. When a person with TB disease of the lungs, that they throat, they cough, they speak, or they sing, TB bacteria can get into the air. People nearby may breathe in these bacteria and become infected. With effective treatment, TB can be a curable disease. Measles is also something that we're monitoring. Right now, there are no current cases of measles in Randolph. I'm not aware of any in Massachusetts at this time, but we know that 17 other states have an increase in measles. If you have not received a measles vaccine, it's called the MMR, you can get that, and that will help your body stay free from measles. Measles is not a disease that you want to get. It's very contagious. It can spread from person to person. COVID and flu. Each year, respiratory viruses are responsible for thousands of hospitalizations and deaths in the United States. In addition to the virus that causes COVID-19, there are many other types of respiratory viruses, including flu and RSV. The good news is action you can take to help protect yourself and others from health risks caused by respiratory viruses. The things that you can do that are quite simple: you can wash your hands and wash them often. Use soap, warm water for at least 20 seconds, especially after sneezing, coughing, using the restroom or the bathroom, before, after touching your nose, before, and especially before eating. So when you're out in the public and maybe you touch a doorknob, your hands could be contaminated, so you want to make sure you wash your hands frequently. And if you are coughing or if you feel like you're sick, you could wear a face covering that may help spread any potential disease. And you also should avoid close contact if you're not feeling well.
So Jerry, I'm thinking of the numbers you just gave us about the diseases, and I know it's important to raise awareness. So what strategies and how does the Randolph Health Department engage with the residents to raise awareness?
We collaborate with other groups in town. We employ a full-time public health nurse, Ann Martin, and we conduct various vaccine and disease management programs. Our health inspectors go out into the restaurants, the homes, and we have camps in town and evaluate any environmental conditions that may cause sickness. We partner with Codman Community Health Center, and currently they are present at Randolph High School for primary and behavioral health related issues. In addition, there are social workers on staff at the RICC, that's the Randolph Intergenerational Community Center. And Randolph Public Health often partners with other health agencies to provide information. We have gatherings at the RICC. We offer support and information by healthcare professionals.
Can you tell us about a successful public health program? Any successful
Only one?
stories?
I can tell you.
COVID?
All right. So, yeah, I mean, we have a team of professionals I'm very proud of in Randolph, and we have terrific support by the town manager and the city councilors and other department heads in town. So during the height of the COVID-19 pandemic, the vaccine clinic serviced residents of Randolph and surrounding communities. And we were able to safely vaccinate and give out both COVID and flu vaccines and during that time period, we vaccinated over 55,000 people. We also gave out PCR testing, and that number is over 60,000 people that were tested during that time period, all through the drive-through and other pop-up clinics and pop-up testing sites. And we provided residents with face coverings and the COVID home test kits, just like we're doing now still. Another program that we're really proud of is, I mentioned it earlier, the annual Household Hazardous Waste Day. Well, last year we had over 400 residents participate. The date for this event is on Saturday, August 10th, yep, from 9 to 12 at the high school. And you're able to drop off your paint-related materials, cleaners, any automotive fluids, old fluorescent light bulbs. We're concerned about fluorescent light bulbs because of the mercury that's inside of them, batteries, TVs, computers, and tires. And finally, our partnership with the Randolph Animal Hospital for our rabies vaccination clinic is coming up. That's on Saturday, April 13th from 9 a.m. until 12 noon at Randolph High School. Here, residents can bring their pets, their cats and their dogs, to get vaccinated for rabies. It's a low-cost event, and we really like to see a good turnout. It's good for the community, it's good for the pets, it's good for the owners of the pets.
Yeah, that's another popular event, the rabies clinic.
Yep.
So another question I have for you, it's based on a report, a statement that the U.S. Surgeon General report for 2023, where he stated that the health and societal impacts of social isolation and loneliness are a critical public health concern in light of mounting evidence of millions of Americans. So this represents an urgent public health concern as it affects your health and your well-being. As a public health professional, Jerry, what are some recommendations for our community at all levels to advance and increase social connections in Randolph?
Yes, Peggy, that's a very complex situation that you described. So Randolph's very fortunate to have a facility dedicated to residents of all ages, and it's called the Randolph Intergenerational Community Center. The center offers a number of programs dedicated to those that are 4 years of age and up. These programs include programs for children, teens, adults, and seniors. Here they offer classes where you could sign up for swimming, martial arts, video games, yoga, exercise classes, or basketball. And it's just a small sample of these classes that are offered at the RICC. There are many more activities at this facility. There's also a track for walking or running. They have a community room to play cards or games or just to meet other people. There's also a gym, a ping pong room. This facility is great for meeting places for socialization. Randolph also has a skating rink, a library, many restaurants and places where people can meet and socialize.
The community center is a great place, and if you don't know where it is, it's located at 128 Pleasant Street in Randolph. And like Jerry said, it's all ages, so their hours are 8:30 to 2 p.m. for seniors, and the community can come after 2 to use that facility. And finally, Jerry, do you have any healthy tips for everybody, especially the Haitian community?
Certainly. So my advice is to stay active, explore Randolph and the surrounding area, maintain a healthy diet of fresh fruits, vegetables, and lean proteins, try to limit processed foods and sugary drinks, limit screen time on your computer except when you're watching this show, participate in opportunities to walk, dance, or play, seek support from mental health professionals, religious leaders, and trusted community members if you're feeling anxious. And finally, stay hydrated, drink plenty of water, and get at least 8 hours of rest per day.
Thank you. These are great recommendations. And Chita Tande was delighted to have Jerry as a guest today. He's the Public Health Commissioner. And if you have any question for him, you can reach out to the office, which is 781-961-0924. That's at the Randolph Town Hall. And thank you for watching Chita Tande, and I'll see you again next month.